All right, if you are just joining, you're welcome. Tonight we want to talk about the size and location of fibroids, right? And this is the fertility mistake that almost everyone makes. So we're going to look at that, look at some of those details and see what helps, right? Um, when a patient walks into a clinic with that ultrasound report, right? The usual thing, most of them, especially like somebody that posted something like that a few days ago, they go straight to the numbers that they wrote there, right? For example, the fibroid is measuring 8.2 centimeter. When you see that kind of figure, your heart just race because the reason is because most people believe that the bigger the fibroid, the bigger the fertility problems, right? But you will not blame them. You will not blame them because it is almost correct, right? It sounds logical because of the things we talked about yesterday. But again, understand that even sometimes you can have a tiny fibroid that will cause major fertility concern. One tiny little fibroid sitting down there will be causing implantation failure. You wonder what is going on. Why can't I conceive? Whereas you can also have a large fibroid that will cause almost no disruption at all. It's as though it's not there. Right? That is why when you talk about fibroid, don't compare your situation with other people. Why? Because you must deal with it with specifics. Right? The person was evaluated for what? What is the size? What is the location? You are evaluated for what? What is your own size and what is your own location? Because when it comes to fibroids, the location often matters more than the size. I will say it again, let it soak. When it comes to fibroid, the location often matters more than the size, right? Uh, these singular concepts, this singular idea changes everything. And that's why when you understand it, it gives you a better approach to your journey, right? So let's dissect these gists and see how much of it we can understand tonight, right? You know that many people are always in panic mode because of the measurement, the size, but they are missing something very important, right? And that important thing is the location of the fibroid. So that they say you have 4 centimeter diameter of fibroid, what does that mean? The question will ask you, where is the location? If if fertility is your concern, right? For you to understand fibroid properly, you need to imagine the uterus as a house that is being prepared for a guest, right? Just understand that analogy and let it so, right? Because pregnancy depends on structure, it depends on space, and it depends on the interior environment, internal environment, right? That's what pregnancy depends on. And if you have been here for some time, you already know what we what we mean by structure, space, and internal environment. Yeah. So if there is fibroid that is disrupting any of these three description, you're certainly going to have some problems. Yeah. Lady G, thank you very much. If you're here, please tap on your screen and share the live. There are people that are suffering with this fibroid and they don't know where else to get clarity, where to get answers. And the answer is in your hands to tap on the screen so that they find us. If you are not tapping, it means that you don't want them to know. You want them to continue to suffer in their ignorance. Please tap on the screen. That's why we are here. We are not asking you for gifts. We're asking you for taps, right? So tap on your screen. Don't be a gatekeeper, right? So now imagine you place a growth somewhere in this whole structure, right? Right. Remember I said imagine the uterus as a house that you're preparing for a guest. Now place a growth somewhere in this house, right? Maybe a large object outside the building, which may cause pressure or even change the appearance. But it will not it may not be affecting much of the space that the person will need to live in. Then you place something small, maybe a small object inside the bedroom that completely distorts the environment of the bedroom. For example, maybe it's blocking the windows, you cannot breathe, right? Or it's causing water to pool in the. So that is essentially how to see fibroid, right? A small fibroid inside the uterus may cause fertility problems, while a large one outside the uterus may not cause any problem at all, right? So that is what fibroid does, and location is key. Yeah, location is key, and the reason why location changes everything when it comes to fibroid is because the embryo would have to implant inside the uterine cavity, right? So when you have fibroid that is growing in the cavity, distorting the endometrial space, or even preventing implantation from taking place, that is a fertility concern. Anything that distorts that pathway, and if fibroid is that thing, it will cause you fertility concern, right? Even if it's small fibroid. There are three major fibroid locations. Three major fibroid locations, which we talked about earlier. But because of today's gist, we'll just repeat it so that some people can understand. The first one, which I call the most notorious one, right, is the one we call submucosal fibroid. Small but mighty, right? These ones, they grow inside the uterine cavity. This fibroid grow inside the uterus, right? And this type of location will affect implantation. It will it raise a greater risk of miscarriage. Why? The only thing that affects implantation, definitely, even if implantation takes place, it may miscarry eventually, and also it will disrupt fertility. The reason is because they interfere with the lining, the mitral lining, and they also interfere with the attachment of embryo, right? And if they distort or disrupt the uterine cavity, it will interfere with fertility, right? And I said that even if it is small, this location, even if the fibroid is small, is going to matter a great deal. Why? Because that location is a very, very terrible location for a fibroid to sit down, right? Why? Because when there is a tiny distortion, right, in the space where implantation is supposed to occur, it will reduce. Even if implantation takes place, it will destabilize the embryo. Besides destabilizing it, it will cause uh, alteration in blood flow. And you know that for implantation to be successful, blood flow is supposed to be efficient, right? And fibroid inside the uterus will cause inflammation. All these are enemy to implantation. So in infertility, small, that the thing is small does not always mean it will not cause you problem. So the question is, that fibroid you are worried about, where is it located? Inside the uterus? If it's inside the uterus, we call it submucosal fibroid, and that is small but mighty, right? So the other location is the one we call the intramural fibroid. This one, they are within the wall of the uterus, the muscular wall of the uterus, right? And the way they affect you will depend on their size largely, the number, how many they are, and whether they are actually distorting the uterine cavity, right? So if they are not doing any of these things, you may as well don't worry. Just continue to knock waiting no good, conceive and have your babies, right? But small intrauterine fibroids, actually small ones, right? They may not necessarily have any impact at all. Sometimes you may not even know they are there. But large ones, oh boy, large ones may compress the space, distort blood flow, and also alter uterine contractions. So if you don't know anything about uterine contractions, you need to go and catch up on all the videos on the YouTube channel, right? Just search my name there, Dr. Godwin EMB, and you'll see it, right? So that is the thing. Then the third one, the third type of fibroid is the subserosal, right? Those ones are the ones outside the uterus. Shaggy Lawrence, you're welcome. Thank you very much. So these ones, they grow outside the uterus and they can become very large, right? Very large and noticeable. But yet, even at that, they can also cause minimal implantation disruption. Why? Because they are not disturbing anything. They are just growing the other way. They are not growing this way, right? Because they just remain outside there. They don't want to disturb anybody. They keep growing, right? So you can have a large subserosal fibroid, which may cause you pressure, right? The symptom you feel may be more of pressure, frequent urination, and sometimes heaviness in your pelvic area. That may just be the only thing they may cause you. And even at that, they still will not pose any challenge to your ability to conceive, right? So that is a big deal. That is a big deal. That's why we said earlier that the size and location is key. Small, tiny fibroid inside the uterus may cause you serious fertility concern, while large ones outside the uterus may not cause you any concern at all. So location is key. Is that okay? The reason we are talking about this is because most people fear a lot, and fear comes from ignorance. Is that okay? So, but clinically, what you just need to know that specialists often worry more about the fibroids that are closest to the uterine cavity. And now that's where the difference between two different individuals that have fibroid and have different success rates in fertility. That's where the difference is, right? But this is how location can affect pregnancy. Fibroids affect fertility through the mechanism I talked about yesterday. But for those who are just joining, the mechanism I mentioned yesterday was fibroid affects fertility through distortion of the implantation space, through reducing the blood flow, the blood supply to the uterus. They also trigger local inflammation, right? When there is inflammation, that's a matter, and also the uterine contraction of the uterus. And now this becomes some of the strongest effects, right? Where the fibroid is interacting directly with the endometrium. That's why the location of the fibroid will change all the biological impacts. So if you have been diagnosed with fibroid, I'm asking again, where is the location? That will give you a great idea whether you should worry too much or not worry at all. Right? When somebody asked the other time whether very large fibroid can still affect fertility or not affect fertility. Well, it's large ones may not affect fertility, right? Because if the fibroid is actually growing outside the uterus, right, they definitely will be leaving the cavity intact, and the cavity is where the pregnancy will occur, right? So if nothing is distorting this, you are good. They also will not distort blood flow to that area, even though they are also sharing from the blood flow. Yeah, and if none of these things happen, you can go ahead conceive, and even though there is fibroid, pregnancy can still happen normally, even with large fibroid. But it's a question of location. Is that okay? Chief Babatunde, you're welcome. I see you. Right? And that is surprising to many, right? Martha is here. Good evening, Martha. How was your day? Thank you for the heart. That surprised many. Oh, someone say, I know somebody who has fibroid. They say the fibroid is big. Well, yeah, she now has 3 kids. Yes, it's the same thing I'm talking about. What is the size of the fibroid and what is the location of the fibroid? Location matters more than the size. The size matters, yeah, but location is king, right? Can small fibroid cause repeated pregnancy loss? Can that happen? Yes. Yes, it can. Especially if it is submucosal. Remember submucosal, the one that is inside the uterine cavity? That is the one we're talking about, right? So if you have it inside the uterine cavity, yes, it can cause pregnancy loss. If it is distorting implantation, yes, it can cause pregnancy loss. Fibroid vibe, thank you very much. Martha, thank you for the shares. Right. And any fibroid that interferes with the blood supply, vascular support, will cause pregnancy loss. Because when it comes to implantation, yeah, implantation will require space, ability for the uterine wall to receive the embryo, and also the precision in which these things happen. So even the smallest disruption would matter. It would matter. Yeah. So that area is key. So you want to find out what the fibroid is actually doing there, right? So these are important things. These are important things. Now, this one it will interest. Some people have asked that question. I know they are not here today, which I'm feeling very sorry for them right now. Right? Strapbox is here. Hello, Strapbox. Thank God it's Friday. Good to see you. Right? Now, There are surgical decision mistakes that people make when it comes to fibroid and fibroid removal. Some people assume that large fibroid automatically means surgery. And because it's large, therefore surgery, right? And if you have been following what I've been saying for the past 3 days, you already know that it's not necessarily so. Large fibroid is not necessarily automatic surgery, no. But the real question you want to be asking is whether the uterine cavity is distorted, whether implantation will be affected, yeah, whether there are severe symptoms. Because some fibroids may be there for years, you don't even know they are there, right? You don't even know they are there. But some others will cause symptoms. So that's what we want to be looking at. Are there severe symptoms? And is pregnancy outcome going to be compromised as a result of this fibroid? Because removing fibroid does not necessarily mean that you would become pregnant after it is removed. No, right? It does not necessarily mean so. Removing fibroid unnecessarily also carries risk. Good evening, Ivy is here. Hello, Ivy. Thank God it's Friday. You're welcome. Right? So, removing fibroid does not necessarily mean you become pregnant immediately. And removing fibroid unnecessarily also carries risk. You got to understand that. So, you have to be careful what you are doing. If you don't understand, ask questions. And if you have questions, if you ask questions, you still don't understand the answer, go and get second opinion. You must not be there and quench, right? So thank you very much for the heart, Ivy. So I said all that to say that fibroids are not judged properly by size alone. Yeah. Strap box is a big dog. Okay, no wala, no wala. Slide into my DM, no wala. Right. So I was saying that you don't decide, you don't judge fibroid just simply because they said it is 10 centimeter. There are other things that are considered. And if you have been here, you already know the things that are considered. You are talking about the biological behavior of the fibroid. If I remember yesterday, I was asking what is the tribe of your fibroid, right? So that's the kind of things you're looking at. The biological behavior, anatomical location, the functional disruption of fibroid. Because some people have fibroid, they are bleeding profusely. That is symptomatic. That is concerning, right? You can even become anemic because of that. All right. So these are the things you consider: the tribe of the fibroid, the biological behavior, the location, anatomical location, and the functional disruption. Right. So these are the issues you look at when you are dealing with whether or not you want to remove fibroid. Right. And I can tell you for free, that's why fertility medicine focuses heavily, right, on the relationship of the fibroid to the uterine cavity, right? So if you have a fibroid, what is the relationship with the uterine cavity? Talk to your doctor. Huh? Some of you will now go get mouth for social media. Hey, doctor, I want to ask, because you're getting it for free. But when you go and pay money and you're looking the person in the eye, you cannot ask the question. Now for here where is they free, now they get mouth. So sit down with your doctor with the knowledge you have. Ask questions. Ask questions, right? So that they can help you, right? Anything that distorts the uterine cavity will disrupt pregnancy. And a stage fright. But when you come to social media, it's not stage fright. As a matter, be careful. But I've always wondered, why is this so? You see, some people, they pay heavily to see a doctor, right? And they sit in front of the doctor, they can't ask any question. But they come to social media, the only thing they have to pay is to tap on the screen. But they will ask you, follow you, enter your DM, ask you, enter your green app, ask you, they won't finish you for free. The reason why I started, I was doing that for free before, but nowadays, you come to my DM, you have to pay, right? Like just for a few people that may not pay, because those ones they are heavy gifters. So gifters, your case is different. All right, so let's look at these two cases. All right, let's look at these two cases. Yes, so matter, why is your eyeball rolling like this? What's happen? If you give me a lion like this, I'll just pack my things, come to your house. I will consult with you for 1 year. Right? We will do consultation for 1 year, right? Until you get the result. So, but this thing I just said now reminds me of my wonderful people. Thank God they are not here, so I can say that. These are wonderful people. You just know that these people are intentional. They're intentional. They want to see results. So the very first day, they got into my DM. Of course, they pay to get there, right? Normally, it's 1 month if you pay for consultation. But because of how serious and intentional they are, you tell them to do this, they do. Tell them to knock, they knock. Tell them to bath, they bath. Tell them to take drugs, they take drugs. Tell them to do tests, they do tests. 3 months has passed now, and look at the progress they've made. But for some people, they are not ready to do anything. Say, doctor, don't tell me anything. Just take my womb. When the baby enter, give me, let me put it back. You are not serious with yourself. Anyway, I was going to talk about 2 cases. All right. The first case, the individual has a 9 centimeter subserosal fibroid. That is, the fibroid is outside the uterus, and it's not affecting the uterine cavity, right? Then you have the second case. That person has a 1.5 centimeter fibroid. That one is submucosal. So the first one, subserosal, is the one outside the uterus. Then submucosal is the fibroid that is inside the uterine cavity, right? So I want to ask us that are here listening to me, if you have been here since Monday, you already know some things about fibroid. So I want to ask us, between these 2 cases, which one is likely to affect fertility more? Which one will affect fertility more? I will say the case again, because I know some people were not paying attention. Now that I got your attention, I have you where I want you, right? So now I'll ask the question again. Woman A has fibroid that is 9 centimeter in diameter, and the fibroid is located outside the uterus. Woman B have fibroid that is 1.5 centimeter, but this 1.5 centimeter diameter fibroid is inside the uterus, the uterine cavity. The question is between A and B. Which of them is likely to have fertility issues? Over to you in the comment section. Talk to me. Which of them is likely to have fertility issues? Is it the woman with 9 centimeter fibroid or the woman with 1.5 centimeter fibroid? Comfort Idogwani said B. Okay, let me listen to others. Strapbox said B. Okay, Starbucks said 1.5. That is B. Good evening, Juliet John. You're welcome. If you're just joining, you're welcome. If you're just joining, you can answer the question. Right? Where did the other people go? The other 11 people disappeared from the live stream. All right. Yes, they are correct. They are correct. Why? Because remember that the location of the fibroid matters more than the size of the fibroid. Is that okay? Okay, I told you they left the live stream and they are now coming back, right? So, and that is why, you see, I have serious concern. This is not to demarcate anybody, right? Please, if you think that advert suits you, go ahead and patronize. That does not concern me. But I need to say this. Most of what you get as a drug that takes away fibroid or reduces fibroid, all that, after all these many years, I've not found one person that I know that went that direction that actually got the result from what they said it will do. They say, oh, take this herbs, it will crush the fibroid. Well, that has not happened all these years. Take this drug, 1 tablet, 2 tablets, it will crush the fibroid. Well, see, understand, anything that affects the fibroid affects your reproductive system, right? So make your choice, right? Make your choice. Because tomorrow now they may bring deal to me. Say, bro, help us market this drug for fibroid. A deal of 100 million. I go market them, right? But remember, I've already taught you about fibroid, right? So because this world are only supportive to those that tell lies. So if you know how to tell lies, they will support you. But if you want to tell truth, you're on your own. You're on your own. And that's why a lot of people are suffering for a very long time. Right? So many examples to give, but I can't because these are personal examples of people. Right? So long story short, if you have been diagnosed with fibroids, right, don't focus or don't just rely on how big the fibroid is. Right? What I want you to do is I want you to ask the question: where exactly is this fibroid located? Question number 1. Is the fibroid distorting the uterine cavity? Question number 2. Is implantation likely to be affected? Have you heard about it? No, I've not. I've not heard about it. You tell me about it. I've not. So is implantation likely to be affected due to this fibroid? That is question number 3. And question number 4, is the fibroid compromising blood supply? This should be the concern, and that should be the basis for surgical decision. Right? That should be the basis. That should be the basis. Because if you don't understand, you may even get treatment that will worsen your fertility problem. Because these answers are the answers that matters more biologically than anything else. Idara, thank you very much. Fibroid will teach you one of the biggest lessons in fertility, right? And I've said that biggest lesson 1 million times already. The size alone does not determine the impact of the fibroid. The other factor is the location. Yeah? So you do not now come and say, because somebody okay. Hold on to that thought, because I'll in just few minutes I'll finish. You'll come up. Let's talk about it. Because we need some clarity on such things, right? They may not be wrong. They may not be wrong. But the problem is, what is the basis for what they are saying? You can have the right solution for the wrong problem. We'll get there. We'll talk about it. Right? So what I was saying is that you can even have a large fibroid, right? Which just occupying space. No symptom. But you can have a small fibroid in the wrongest location that is causing you fertility problems, altering all the biology and functionalities of your uterus. And you've been trying for many years now. Because once you understand some of these simple things that I tell you every night, once you understand them, you stop being afraid of some of these simple reports. You approach your reports with knowledge and ask the right questions. You start understanding exactly the actual biology behind all these things. Right? And actual biology is what we're about to talk about from what Strapbox was saying. Right? So you want to calm down. Don't let the size of the fibroid shock you. Rather, shock it with knowledge. Right? All right. I know a lot of people have fibroid gist to talk about. Oh yeah, send your request. Come up. Let me hear about your fibroid story and what you have done about it. And if there is somebody here, you have actually used herb, a pill, or some form of concoction to destroy fibroid with scientific proof. Come up. I want to see you. Let's talk. Right? Let's talk about it. At least we will now have solution that everybody can run to. Because it's not to downplay anything. It's so that we can get solution for people who are trying to conceive. Right? Mine didn't have much symptoms, just tired. Very small word. That's the problem. If it's small and it's causing issues, it's the problem. Right? These are the issues. When it comes to fibroid, size and location. Yeah? Size and location.